There are moments in our leadership careers that are unforgettable. They shape us. As a chief operating officer of a 13,000 employee health system, I will never forget preparing for and caring for that first surge of COVID patients. I had never worked with that same sense of urgency, the intensity, for such a prolonged period of time. Add to that a deep feeling of responsibility and fear for the safety of our staff and our doctors. We're among the 21 million healthcare workers and managers nationwide who have cared for tens of millions of US COVID patients during an historic pandemic that has changed everything. I hope you feel a depth of pride and accomplishment in everything that you have done. Thank you. Thank you for how you have performed so brilliantly and how you continue to do so. I have never been more proud to be a nurse and healthcare leader. COVID has exposed much about us as individual leaders, about the effectiveness of our teams and the resilience of our organization, and it has laid bare the strengths and the flaws in our health system. If ever there was a time when we needed to lead well, heal well, and stay well, this is the time. Whatever your unique leadership strengths are, now more than ever, you need to leverage them. Each day you're collaborating with others who bring their special gifts to this challenge, and you do amazing things. But today, I want to invite you to pause, to take a breath, because right now, we're all climbing COVID mountain. Think back on the mountain that you've climbed and continue to climb. As we appreciate the extraordinary work that you have done these past many months, it's important that we look forward and think about how you can lead well, heal well, and stay well as you sustain your remarkable efforts. Today, I want to invite you to focus on two essential areas of leadership: well-being and relationships. Because the importance of healthcare leadership has never been more evident than these past several months. Managing is entirely sufficient if we're working in a stable and predictable environment, if we want to maintain the status quo. But COVID, it calls for leaders who are grounded in their commitment to well-being and who understand that relationships are at their heart of their individual and collective success. So let's talk about that kind of leadership. A couple of years ago, my husband Paul and I were taking our son to drop him off at college in Colorado Springs. While he was enjoying some new student experiences, we decided that we would take a hike, something that was just a few miles and we could do it in an afternoon. We did our research and we picked a hike called the Manitou Incline. The trail is the remains of a former cable railway track that was washed out by a rock slide in 1990. It starts at 6,500 feet above sea level and it ascends to 8,595 feet. The distance is just 0.88 miles up. It's considered an extreme trail by hiking enthusiasts from around the world. My husband Paul and I, we looked at each other and we said, well, how hard can it be? It's just under a mile. So we tucked some water and some M&Ms into our backpack and we set out for the trail. Looking up at that trail is intimidating. It's a series of 2,744 steps. Some of them are a typical 10 inches and others are a full 2 feet. You can't see the top from the bottom. What you can see is a few hikers slowly slogging their way up the side of the mountain. At the bottom, there's a sign that says, "Do not descend on this trail." The descent is a 4-mile hike down the back side of the mountain, very gradual through the forest. But the front side, the Manitou Incline, is simply too steep to safely descend. From that very first step, you realize that living at sea level places you at a distinct disadvantage. The base of the mountain is at 6,500 feet, which has the effect of leaving you breathless just by tying your shoes. Delivering health care during a pandemic is like hiking at altitude. A hike of just a few hundred feet at sea level is pretty easy, but at altitude it leaves you breathless, exhausted. A day of caring for patients during a pandemic, it's like hiking at altitude. A day of leading teams of frightened and in some cases inexperienced and unfamiliar staff, it feels like hiking at altitude. So coming into it healthy, it will help sustain you. Now, being in good physical and mental shape, it doesn't guarantee that something bad won't happen. But if adversity strikes, the odds of recovering are so much greater. But let's go back to the Manitou Incline. Game for the adventure, my husband, Paul, and I, we set out to conquer those 2,500 plus steps to the top. Now, in our past hiking, we've learned a couple of really valuable lessons. The first of those is that if you have to stop to catch your breath, then you're going too fast. The goal is to find a pace that you can maintain all day long, if you have to reach your destination. The other thing we've learned over the years is that hiking together makes every slope seem less steep. There's actually some research to support this. There's a study in the Journal of Social Psychology, and participants were asked to estimate the steepness of a hill before they climbed it, and those who were planning to hike with a friend estimated that the hill was 20% less steep than those who were planning to hike it alone. Now that's the relational aspect of leadership. That's the relational aspect of life. Relationship-focused leaders, they come alongside their colleagues. They build teams. They work in collaboration. They seek wisdom. They share the journey and they share the glory. And relationship-focused leaders, they say thank you with heartfelt specificity and frequency. So back to the mountain. We start to climb slowly, steadily, breathing deeply. Close to the halfway mark, we came to a second sign, reminding us that there's one and only one bailout point on the ascent. On Manitou, this is the point where you have to decide if you're going to press on to the top or if you're going to bail out and go down the backside of the mountain. If you decide to pass that bailout point, the only way out is up. Now, both my husband and I are seasoned hikers, and we know that there's no shame in a strategic retreat if that's the wisest thing to do. But on that day, we were both doing fine. We felt strong. We had prepared well. We still had some M&Ms in our pocket and some water in our bottles. And so we pressed on past that bailout point, heading for the top of the mountain. For those of us working in healthcare, there is no real option to bail out on our patients. During this pandemic, our communities and our patients, they need us more than ever. As healthcare leaders, your teams, they need you more than they have ever needed you. It's not easy, but you carry on step by step, slow and steady. About 100 steps or so past the last chance to exit the Manitou Incline, we came across a young woman. She was about 30. She was wearing newish hiking boots, carrying an overstuffed pack and a single small bottle of water. She was off to the side of the slope and she was alone. And she was crying, big, gulping sobs. I stopped and I placed a hand on her shoulder, and I did a quick clinical assessment by looking into her eyes, and I could see that she wasn't dying. She wasn't so sure. I asked her her name and what was wrong. "Jane," she gulped. "I'm stuck. I can't breathe. I can't go any further, and I can't go down." As a nurse, I've cared for patients experiencing moments like that. As an executive, I've coached colleagues who felt that they had hit the wall. Once or twice in my own lifetime, I have felt that way myself. Jane was alone. She was breathless. She was scared. She couldn't turn back, and she simply couldn't figure out how to carry on. Perhaps there's been a time in the past year when you hit the wall. Or maybe you or a colleague, maybe a family member is experiencing one of those moments right now. This is the time to ask for more support. This is the time to provide more support, to talk to a colleague. This is the time to make your shared climb 20% less steep. When Paul and I came across that young woman on the Manitou Incline, we already had the 20% rule working in our favor. We were hiking together. It was easy to offer to share our 20% bonus. As I said, "Jane, how about if we do it together?" Now, sometimes simply offering each other a little emotional and moral support is enough. But sometimes we need to do more. As well as being relationship focused, one of the most important roles of leadership is to scan the environment, identify obstacles, and remove the barriers that are getting in the way of people achieving their goals. And these days, their goal may be as simple as getting through their day. Remember back to the earliest days of the pandemic when PPE was in short supply. And as leaders, our barrier to remove was to get a sufficient amount of PPE so that our staff could feel safe, so that they could spend all of their energy caring for patients. That was our barrier to remove. So back to Manitou. I also offered to lighten the young woman's load. "Jane," I said, "how about if I carry your pack and we'll take it slow and steady to the top?" She didn't need much convincing. I sweetened the deal with a few M&Ms, and she peeled off that sweaty pack. And to her great surprise, to my great surprise, within 15 or 20 minutes, we had reached the summit. She was transformed from being frozen by fear and exhaustion and saw it as entirely doable simply because she was in the company of someone else. And for me, I was coaching a stranger up a hill, and I was reflecting on that 20% rule and the opportunity that we have as leaders to come alongside people and lighten their load, reduce the steepness of their climb. Now, I wish I could say that every problem that you have to face would be that simple. It took me 15 minutes, a few M&Ms, some cheerful conversation, and carrying someone's pack, and in no time, we were enjoying the spectacular view from 8,595 feet above sea level, together. But here, on COVID Mountain, we're still taking it step by step. If anyone you know is feeling overwhelmed or immobilized right now, it may take days or weeks or even months to help them get unstuck. But remember this, anything seems easier in the company of someone who cares. Added to this, as leaders, we have the power and the responsibility to remove barriers for our teams and colleagues when needed. That's the power of relationship-focused leadership. Relationship-focused leaders, they move purposefully and persistently from person to person, not issue to issue. Right now, our teams, they need us to be more than managers. They need us to be leaders who are immersed in our relationships and who put people first. So how do we do this? It starts with well-being, your well-being. As a leader, it's essential that you attend to your own capacity and resilience. It's essential that you model well-being and support your team members' well-being. It's essential that you find ways to pause and reconnect with how you're feeling physically and emotionally. Remember, by modeling a commitment to your well-being, you give your team permission to do the same. And for those of you who feel you're too busy to focus on well-being, I want to challenge you. There is just too much at stake. As a leader, your family and your team, they need you now more than ever. Helping ourselves and our employees reduce stress, combat burnout, get a good night's sleep, a little bit of fresh air every day, eating an apple a day, it means we're able to provide the best leadership possible so our staff can provide the best care possible. It means we're all in better shape to care for and support our colleagues, our friends, and our families. And just as climbing together transformed an impossible slope into an unforgettable summit for Jane and for me and for Paul, it's your relationships now that help make everyone's climb possible as you and your teams care for our community through this pandemic. To lead well, heal well, and to stay well, we need to focus on our relationships together. As a relationship-focused leader, make each and every one of your individual interactions count. Take the time to build and nurture relationships, one conversation at a time. How are your team members handling the challenges of childcare and homeschooling at the same time that they're working? Are they worried about their elderly parents or a partner who's lost their job? Well, there's not always a lot we can do to change those huge events. We know the 20% rule. We know that simply by coming alongside people, we can lessen the steepness of their climb. As we consider how to lead well during a pandemic, I want to tell you one last healthcare story. It's a personal story, and it's at the heart of what motivates me today as a leader and a coach. 20 years ago, I was a brand new mom, and several months before my son's arrival, I had accepted a new leadership position. It was a wonderful career opportunity and a chance to test my theory that I could transfer leadership skills from one organization to another. I accepted a job as the Chief Operating Officer of the Aquarium of the Pacific in Long Beach. I woke up one morning and I felt some tingling in my arm. I thought I just slept on it funny and that it would pass, but it didn't. It progressed across my torso and down my other arm. By lunchtime, I had spastic movements in my arms and I couldn't pick my baby up out of his crib. By dinner time, I couldn't walk. I was in the hospital getting a neurology consult and a spinal tap and an MRI. And I laid in that MRI machine and I imagined all kinds of awful. I imagined a brain tumor, ALS. I conjured up every neurological diagnosis that I had learned in my clinical career. The next morning, the doctor came to my bedside and he said, "Tammie, you have multiple plaques on your brain and your spinal cord. They're interfering with the electrical impulses by demyelinating the nerves, and it's causing those impulses, both electrical and motor, to go haywire. You have multiple sclerosis." Tammie, have you never experienced any neurological symptoms before? I don't think so, I said. I haven't really thought about it. I've been too busy. Now, intellectually, I knew that this diagnosis was better than some of the other things that I had imagined. But I was having a very hard time seeing my glasses half full. I saw all the things I wasn't going to be able to do independently. I saw the career that I might have to rethink. I saw all the mountains I wasn't going to be able to climb with my son. I was scared. I was exhausted. I was overwhelmed, and I had hit my wall. And then, after 3 weeks in the hospital, right before going home, a compassionate, insightful nurse, she came to my room and she sat on the edge of my bed and she held my hands. And she said, "Tammie, we don't know how this is going to turn out. We don't know if it's going to progress or go in remission. We don't know if you'll get a return of the function that you've lost. But we do know this. We know that if you invest in your well-being, no matter what you've got, if you eat well, if you sleep well, manage your stress and get a little bit of exercise every day, you'll do better." And here in physical rehab, we know that when we're intentional about setting goals with our patients, they do so much better. And I've watched you these last few weeks, and you've got remarkable relationships. You have an amazing husband and great friends. You worked at this hospital for 7 years, and everyone knows you and they want you to do well. Tammie, you've got this. And you know, she was right. That was 20 years ago, and I am so grateful for what that experience taught me. And I'm grateful to that young nurse who led me so well. Well-being, yours. Relationships, ours. As we climb COVID Mountain together and create a vision for the future, healthcare leaders need to be committed first and foremost to well-being and our capacity to lead. You give your colleagues permission to invest in their own well-being by role modeling that same personal investment in yours. And relationships, because leadership is a relationship between someone who says, "Follow me," and someone else who says, "I will." Focusing on well-being and relationships, it works in life and it works in leadership. Step by step, slowly, steadily, breathing deeply, you can lead your teams as you climb at a pace that allows you to progress without stopping. Remember, right now we're climbing at altitude, and in healthcare, we don't have a bailout option. More than ever, our teams and our families, they need us to lead well, to heal well, and to stay well together. Remember, you've got this.